Mild neurocognitive disorder represents a critical and often misunderstood condition that exists in the gray area between normal age-related cognitive changes and major neurocognitive disorder, commonly known as dementia. This condition affects millions of individuals worldwide, yet it remains one of the most overlooked and underdiagnosed cognitive disorders of our time. Unlike the subtle memory lapses that naturally occur with aging, mild neurocognitive disorder involves measurable cognitive decline that is noticeable to the individual and their close contacts, but does not yet significantly interfere with independence in everyday activities. Understanding this condition is crucial because it may represent the earliest detectable stage of progressive neurodegenerative diseases, offering a unique window of opportunity for intervention, planning, and potentially slowing further decline. The diagnostic category of mild neurocognitive disorder was formally introduced in the Diagnostic and Statistical Manual of Mental Disorders 5th edition, replacing the previous term, mild cognitive impairment, and providing more precise criteria for identification. This condition is defined by modest cognitive decline from a previous level of performance in one or more cognitive domains, including complex attention, executive function, learning and memory, language, perceptual motor skills, or social cognition. The key distinguishing feature is that while cognitive changes are evident and concerning, they do not substantially interfere with independence in complex instrumental activities of daily living, though individuals may need to exert extra effort, use compensatory strategies, or require occasional assistance to maintain their usual level of functioning. The prevalence of mild neurocognitive disorder varies significantly depending on the population studied and diagnostic criteria used, but research suggests it affects approximately 15 to 20% of adults over age 65. This condition serves as an important intermediate stage between normal cognitive aging and dementia, with studies indicating that individuals with mild neurocognitive disorder progress to major neurocognitive disorder at rates of 10 to 15% per year, compared to 1 to 2% per year in cognitively normal older adults. However, it's crucial to understand that mild neurocognitive disorder is not inevitably progressive, and some individuals may remain stable or even improve over time, particularly when underlying causes are identified and treated. Understanding the various subtypes and underlying causes of mild neurocognitive disorder is essential for appropriate diagnosis and management. Alzheimer's disease represents the most common underlying pathology, typically presenting with episodic memory difficulties, word-finding problems, and subtle changes in executive function. Individuals may notice difficulty remembering recent conversations, appointments, or where they placed common items, though these memory problems don't yet significantly impact daily functioning. The progression pattern in Alzheimer's-related mild neurocognitive disorder tends to be gradual and consistent, with memory problems often being the most prominent early symptom. Vascular mild neurocognitive disorder results from cerebrovascular disease, including small strokes, white matter changes, or chronic reduced blood flow to brain tissue. This subtype often presents with executive dysfunction, processing speed deficits, and attention problems rather than primary memory loss. Individuals may experience difficulty with planning, organizing, multitasking, or maintaining focus during complex activities. The progression of vascular mild neurocognitive disorder may be more variable than Alzheimer's disease, sometimes showing stepwise changes related to vascular events rather than steady decline. Lewy Body mild neurocognitive disorder involves the early stages of Lewy Body disease and may present with cognitive fluctuations, mild visual spatial difficulties, and subtle changes in attention and executive function. Some individuals may experience early symptoms such as vivid dreams with acting out behaviors, mild movement difficulties, or occasional visual misperceptions, though these symptoms are often less prominent than in later stages of a disease. Frontotemporal mild neurocognitive disorder affects younger individuals, typically those in their 50s and 60s, and may present with subtle changes in personality, behavior, or language function rather than memory problems. Early signs might include decreased empathy, social disinhibition, changes in food preferences, or mild word-finding difficulties, depending on which brain regions are primarily affected. Other causes of mild neurocognitive disorder include traumatic brain injury, substance use disorders, HIV infection, various medical conditions, and medication side effects. Identifying these potentially treatable causes is crucial because addressing underlying factors may lead to improvement or stabilization of cognitive function. The clinical presentation of mild neurocognitive disorder can be subtle and varied, making recognition challenging for both individuals and their healthcare providers. Memory-related symptoms may include difficulty remembering recent conversations, appointments, or names of acquaintances, though long-term memories typically remain intact. Individuals might notice they need to write things down more frequently or rely more heavily on calendars and reminders. Executive function changes may manifest as increased difficulty with planning complex activities, managing multiple tasks simultaneously, or making decisions that were previously routine. Language symptoms in mild neurocognitive disorder often involve word-finding difficulties, particularly for proper names or less frequently used words. Individuals may describe feeling like words are on the tip of their tongue more often or may use circumlocution, describing objects or concepts rather than using specific words. Reading comprehension may become more effortful, particularly for complex material, though basic reading skills remain preserved. Attention and processing speed changes may be noticed as increased difficulty concentrating during conversations, meetings, or while reading. Individuals may feel more easily distracted or find it takes longer to complete familiar tasks. These changes are often subtle and may initially be attributed to stress, fatigue, or normal aging, leading to delayed recognition and diagnosis. The impact of mild neurocognitive disorder on daily functioning is typically subtle but may become apparent in complex activities that require higher-level cognitive skills. Individuals may continue to manage basic self-care activities independently, but may struggle with tasks such as managing complex financial transactions, following detailed medication regimens, or navigating unfamiliar environments. Some people may voluntarily reduce their involvement in challenging activities or may require occasional assistance or extra time to complete tasks they previously managed easily. Workplace functioning may be affected, particularly in cognitively demanding jobs. Individuals may notice decreased efficiency, increased difficulty learning new procedures, or challenges managing multiple priorities simultaneously. However, many people with mild neurocognitive disorder continue working successfully, often by developing compensatory strategies or modifying their work environment to accommodate their changing abilities. Social functioning typically remains largely intact in mild neurocognitive disorder, though some individuals may experience increased anxiety in social situations due to concerns about their cognitive abilities. Family members and close friends often notice subtle changes in cognitive function before the individual seeks professional help, making their observations valuable for early detection and diagnosis. The diagnostic process for mild neurocognitive disorder requires comprehensive evaluation by qualified healthcare professionals, often involving collaboration between primary care physicians, neurologists, and neuropsychologists. The assessment begins with detailed medical and cognitive history, including information from both the individual and knowledgeable family members or friends who can provide observations about functional changes over time. This collateral information is particularly important because individuals with mild neurocognitive disorder may have limited awareness of their cognitive changes or may minimize their significance. Cognitive testing plays a crucial role in diagnosing mild neurocognitive disorder, with assessments ranging from brief screening instruments to comprehensive neuropsychological evaluations. The key is demonstrating measurable cognitive decline from estimated previous levels while ruling out other causes of cognitive symptoms. Neuropsychological testing can identify specific patterns of cognitive strengths and weaknesses that may suggest particular underlying causes and help guide treatment planning. Laboratory testing helps identify potentially treatable causes of cognitive decline, including vitamin deficiencies, thyroid disorders, depression, sleep disorders, and medication effects. Addressing these contributing factors may lead to improvement in cognitive function and is an essential component of comprehensive evaluation. Neuroimaging studies may be recommended to rule out structural brain abnormalities and may show early changes associated with neurodegenerative diseases. Emerging biomarker research holds particular promise for mild neurocognitive disorder, as early detection of underlying pathology could guide treatment decisions and prognosis. Cerebrospinal fluid analysis, specialized brain imaging, and blood-based biomarkers are being developed to identify Alzheimer's disease pathology and other neurodegenerative processes before significant clinical symptoms appear. Treatment approaches for mild neurocognitive disorder focus on optimizing cognitive function, addressing modifiable risk factors, and planning for potential future changes. While no medications are specifically approved for mild neurocognitive disorder, some individuals may benefit from treatments targeting underlying conditions such as depression, anxiety, or sleep disorders. Lifestyle interventions represent the cornerstone of management and have shown promise for maintaining cognitive function and potentially slowing progression. Cognitive stimulation through mentally challenging activities, social engagement, and lifelong learning may help maintain cognitive abilities and build cognitive reserve. Regular physical exercise has demonstrated particular benefits for brain health, potentially improving cognitive function and reducing the risk of progression to dementia. Cardiovascular risk factor management, including blood pressure control, diabetes management, and cholesterol reduction, is crucial because vascular health directly impacts brain function.